54 and you're watching CT Style. So 1 in 3 American adults have pre-diabetes. 9 out of 10 of those individuals don't realize they even have the condition. Marketing and Development Manager for VNA Community Healthcare, Abigail Storiali, explains the risk to us. So we were talking, I initially thought this was an older person problem, a senior problem, but this could start at age 45.
Yep, that's one of the risk factors. So prediabetes, of course, is a condition where your blood sugar is higher than normal, but not high enough that you're diagnosed with type 2 diabetes.
Okay.
But it can progress to type 2 diabetes, which can cause blindness, kidney failure, a whole host of other complications, and raise your risk of heart disease and stroke. So it's a serious condition.
Right.
It's an important one to me. I actually have a few risk factors. At my younger age, I have a family history of type 2 diabetes, and my second son was born weighing more than 9 pounds, and that's a risk factor as well. Yep, and so
how do you maintain this, or what do you need to do to take those precautions?
So you keep in mind the risk factors.
Yeah.
Keep in mind that it is over age 45. It is if you're overweight or if you're physically active less than 3 times a week.
Okay.
And then know that simple lifestyle changes can reverse prediabetes. Healthy eating, incorporating exercise into your routine, and the resulting weight loss can actually cut your risk of developing type 2 diabetes in half.
So start moving, right? That's the first step. That would be the best advice. Can it get worse? And then obviously it can lead to type 2 diabetes.
It can, right. So at VNA Community Healthcare and Hospice, starting Tuesday, March 3rd, we're going to launch our year-long Dodge Diabetes program.
Okay.
Which is 26 classes throughout the year that are focused on education and support so that you can commit to making and maintaining those healthy habit changes in your life.
Sure.
And that program is based on the CDC's Prevent T2 lifestyle change program. It's an evidence-based successful program, and that's part of the National Diabetes Prevention Program.
So what is the class going to entail?
So it's a lot of, there's journaling, there's talking about different stressors in your life that can lead to poor choices,
right.
poor habits, like improper eating and not enough exercise.
Sure.
There's working with one another, getting support from other participants in the class, and really just focusing on what can I do in my daily life, what are the small steps I can take so that I can incorporate these healthy habits and I can reduce that risk of diabetes.
Sure. You guys have so many programs that you offer. I mean, this month we're talking about diabetes, but talk to us about some of the other options you have for patients.
We have a lot of options.
Right.
We have, of course, our core services, which is home health care and hospice in the home, and that's through referral from your doctor. But in the community, we have a variety of wellness education programs, living a heart-healthy lifestyle, understanding sleep issues, understanding an Alzheimer's diagnosis. We have yoga classes, Zumba classes, exercise for better balance, Tai Chi that's aimed at helping people who might develop arthritis. Just a lot of programs to help you live the best life possible.
That's so important. And how do people learn about your programs or sign up?
You can visit our website, VNACommunityHealthcare.org. Specifically for our diabetes program, that would be VNACommunityHealthcare.org/Dodge Diabetes. But if you visit our website in general, you can click through to all of our different care programs, our family caregiver support network, and just learn about everything that we do in the community.
So let's just go back to the diabetes for a minute here. Are there any signs? I mean, are you typically in good health, or is there a warning?
Because so many people actually don't realize they're pre-diabetic, it doesn't always start with an immediate warning.
Okay.
As it progresses, there will be signs that you are developing this condition, but you could be at risk right now. You could have prediabetes right now and not realize it. So it is important to get your blood sugar checked, discuss your risk factors with your doctor, and see if there's anything else they recommend that you do.
Family history obviously plays a big part in that as well.
Yes, it does. And we at VNA Community Healthcare and Hospice, we run Ask the Nurse clinics where you could come and have your blood sugar checked so that you know right off the bat, is that a factor I have? Is my blood sugar a little high? And do I need to talk to my doctor about this?
So important. Well, thank you so much for the information. And I wanted to ask you, what are some of the most popular items? What do the patients like the most? Do they sign up for? Or what do you see the biggest following for?
Our Tai Chi classes are very popular. Yes, they are.
And there's people of all ages there? Or?
It's somewhat of an older population, but really we do see quite a variety of people that come in the door. So
that's great. I mean, probably an opportunity to try something that they have never done before.
And it really, Tai Chi is fabulous for getting yourself moving and really keeping yourself in optimal health.
All right, so Dodge Diabetes, that's what we're focusing on this month.
Yep.
Go online. You could visit VNACommunityHealthcare.org to find all the information that you need. Abigail, thanks so much for being here.
Thank you for having me.
All right, that does it for CT Style today. Our friends from Unlocking Connecticut, Bev and Laura, they're going to be here tomorrow with their Valentine's Day gift guide. Are you ready for the holiday?
Sort of.
Oh, that's good. I love that. Plus the Art of Young, they're going to be cooking for us. So we'll see you then. Bye-bye, everybody.